I'm Toni Rakestraw of Organic Birth. Today we'd like to talk a little bit about why some women choose to birth at home. The numbers of women choosing to birth at home are increasing. Other women wonder why someone would choose to stay at home where there are no options for an epidural or other medications for pain relief. Many people equate the pain of childbirth with going to the dentist and suggest that they would be foolish for opting to go through the pain when they wouldn't get a tooth filled without getting pain relief. While I wouldn't try to change a woman's mind if they want to birth in a hospital, the fact remains that for many of us, home birth is the best choice. I was often warned that something would go wrong if I stayed at home. In reality, the vast majority of births happen just fine. Many of the routine procedures in the hospital can actually cause complications. Overloading a woman's body with Pitocin, which is a synthetic form of the natural hormone oxytocin, can not only cause contractions that are harder on the laboring woman and the baby, but it can also overload the natural oxytocin receptors, which makes a woman more prone to postpartum hemorrhage. Pitocin is given in a majority of normal births in the hospital despite these risks to speed things along. It also makes contractions more painful, which brings us to the next question I heard most frequently. What about the pain? An unhindered labor can be painful, there is no doubt about it. I've lived through several painful labors myself, but staying at home is more soothing than rushing off someplace unfamiliar, where strangers are poking and prodding at you. Have you ever felt ill or had a painful headache when you were away from home? Once you got home to your own bed, didn't you feel at least a little bit better because you were in a familiar environment curling up in your own bed? Well, it works that way in labor too. Having the freedom to move around not only speeds up labor by using gravity to help the baby be born, it can help your contractions be much more manageable than being stuck in a bed. Being able to eat and drink as you feel is necessary helps you stay hydrated and provides your body with energy that is needed to help your labor progress. In the case that something does go wrong, there's usually plenty of warning time. A midwife is trained to recognize signs that deviate from normal and can advise you accordingly. Even with her expertise, most mothers will know deep inside if something feels wrong and may suggest transporting to the midwife. If you've seen the film The Business of Being Born, not only were you treated to footage of some beautiful home births, but the last birth of the film's director showed there was ample time to transport to the hospital when a complication occurred. Unlike on television, labor seldom presents as an emergency with only a few contractions until the birth. Statistics showing the safety of home birth from a study done by Dr. Lewis Mayle showed that while labors might be a bit longer at home, there were no birth injuries or inductions at home, compared to 30 injuries and 22 inductions in the hospital group. The cesarean rate was much lower at home, as was the use of instrumental delivery. Resuscitation of the newborn was required much less often at home, and there were more cases of respiratory distress, meconium, hemorrhage, and maternal tearing in the hospital than at home. Many of these higher rates can be directly attributed to common routine procedures in the hospital, such as amniotomy, episiotomy, Pitocin, and other interventions. Having given birth in both the hospital and at home, I can confidently say I'd much rather stay home and forego the pain medication. My babies born at home had much gentler entrances into the world, surrounded by the family that was eagerly awaiting them. My babies that were born in the hospital were handled by staff who did not have a vested interest in them. It's true they were handled efficiently and competently, but not with the same love and gentleness that we had at home. My hospital babies were bathed, swaddled, and capped before I got to really get a chance to know them. At home, I could snuggle with a wet, gooey baby that was full of the scent of birth and newness. This scent is a strong hormonal trigger for mothers to release mothering hormones like prolactin and oxytocin. The oxytocin helps her uterus return to its pre-pregnancy size and prevents hemorrhage. It helps her fall in love with her newborn. Prolactin fills her with the ecstatic feeling one feels after an orgasm and helps her milk release to feed her newborn. In a labor that is not hindered by IVs, synthetic hormones, and interruptions, these and other hormones like beta-endorphins, epinephrine, and norepinephrine help both mom and baby work through labor and adapt to life after birth. So why do some women choose to birth at home? For me, it was to fully birth my babies without the hassles I experienced in the hospital. I wanted those precious new moments with my baby that the hospital staff took. I wanted to give my baby a gentle start without subjecting them to being forcibly pulled from my body. I wanted them to know love from the first instant that they entered this world. If you want to learn more about home birth, come visit us at organicbirth.com.